Om Dham Dhanvantare Namaha. Namo Dhanvantarim Adidevam Surasurair Vandita Pada Padmam Loke Jararut Vayamurtyunasham Tataramesham Vividashadina. This topic is study on thoracentesis. Thoracentesis means the entering or entering the pleural cavity, pleural fluid tapping. So it is diagnostic, used as diagnostic and therapeutic also. Diagnostic to diagnose the type of pleural effusion, and therapeutic to treat the pleural effusion. This is how you see in the pleural cavity, there is the accumulation of excess fluid that is causing pleural effusion or hydrothorax. So we can take the fluid, tap the fluid, and send for analysis to the laboratory, and we can have the diagnosis whether it is tubercular infection or due to translate, that is due to cirrhosis of the liver or nephrotic syndrome or hypertonemia. Thoracentesis is a procedure that is performed to remove fluid from the thoracic cavity. It can be done for both diagnostic and therapeutic purposes. A potential space exists in the left and right side of the chest cavity between the inner chest wall and lung. Healthy individuals, a trace amount of fluid is found in this space, provides lubrication between the lung parenchyma and musculoskeletal structures of the rib cage during expansion and recoil. However, excess fluid is pathological. Volume of excess fluid, the rate of accumulation, the cellular content of the fluid, and the chemical composition of fluid are all used to guide the management and differential diagnosis of underlying etiology. The volume of excess fluid, rate of accumulation, cellular content of the fluid, and the chemical composition. So these are used to assess the cause and the cause. Thoracentesis is a procedure that is performed to remove fluid from the thoracic cavity for both diagnostic and therapeutic purposes. Thoracentesis is also known as thoracentesis, pleural tap, needle thoracostomy, or needle decompression. A cannula or hollow needle is introduced into the thorax after administration of local anesthesia. The indications of thoracentesis or pleural tapping. The indications of thoracentesis are relatively broad, including diagnostic and therapeutic clinical management. Thoracentesis should be performed diagnostically whenever the excessive fluid is of unknown etiology. It can be performed therapeutically when the volume of fluid is causing significant clinical symptoms like breathlessness, chest pain. Typically, diagnostic thoracentesis is also small volume, 30 to 20 36 screen. Unless the etiology is obvious, the first time thoracentesis should have a diagnostic simple collected for laboratory and pathology analysis. Typically, therapeutic thoracentesis is a large volume, multi-liters of fluid. A small sample of large volume thoracentesis should be sent for analysis when the etiology of the fluid is unknown or there is a question of a change in the etiology, that is, new infection, decompensated chronic condition. So, the pleural fluid tag will be straw color in tuberculosis. It will be pale yellow in some other condition. It will be colorless in case of cirrhosis of the liver or nephrotic syndrome. So, on traumatic tag, it will be red color, or in malignancy in the lungs, the pleural fluid will be red color. So, actually, procedure is so the rib, the flanks, the rib intercostal area, the fourth or fifth, you are applying the anesthetic, local anesthetic, injecting. After that, you are puncturing at the lower border of the thorax of the rib, the fourth or fifth rib, lower border. You are going to puncture, and when the fluid comes, puncture the incision is stopped and it is attached to a tube to drain the fluid. If the volume of fluid is anticipated to accumulate quickly, is often left in place to collect this fluid. Is often is in trauma, it is chemothorax, cancer, it is malignant effusion, postoperative, it is the cardiothoracic postoperative healing or inflammatory conditions, and end-stage metabolic conditions with the systemic excessive colloid leak, it is cirrhosis or malabsorption syndromes. A fluid collection that is believed to be infected should be drained to eliminate the source of infection and or reservoirs of infection. Now let us see the contraindications. Contraindications of thoracentesis. There are no absolute contraindications. Relative contraindications include any condition that prohibits safe positioning of the patient, uncontrollable coagulation with either through medications or iatrogenic or intrinsic, or conditions in which the potential complication of the procedure outweigh the benefits. The complications include bleeding, pain, and infection at the point of needle entry. If the approach is made too high in the intercostal space, damage to the costal vasculature and nerve injury is possible. If too much fluid is removed, or if the fluid is removed too rapidly, for example, using negative pressure chamber, the expansion is post expansion, pulmonary edema. Removal of significant fluid volumes may also induce vasovagal result. If the procedural needle catheter is passed through diseased tissue prior to entering the chest cavity, that process can be extended into the chest space. For example, passing the needle through a thoracic or pleural tumor can seed the thoracic cavity, or passing the needle through a chest wall abscess or otherwise infected tissue can result in emphysema. Clinical significance of thoracentesis. Thoracentesis may relieve pressure from fluid on the lungs, treating symptoms such as pain and shortness of breath. Evaluation of the fluid removed may determine the underlying cause of aqueous fluid in the pleural space. That is, depends on the amount of fluid and the pressure it is out, and the infection, then chemical consequence, they are all controlled. They are useful in assessing the cause. Here you see the position of the patient and thoracentesis is done. This is how it is done. You can see in the left side there is a hydrothoracic, okay, pleural vision, and the position of the patient and tapping. The patient with the patient of this X-ray, you can see the bronchovaster. Actually, in the pleural effusion, untapped one, there will be white uniform haziness in the base. The postophrenic angle is obliterated initially, and there will be a ground glass appearance in the base, and untapped one, the upper border will be inverted S shape. Tapped one, air fluid level will be seen. This is hydrothorax. See, fluid in the pleural cavity on the right side. This is also the pleural effusion and the patient position for thoracentesis. See where it is tapped. Okay. Hammer close area of tapping. And in the left side, you can see pleural effusion. The normal lungs, and second picture there is a pleural effusion in the right side, right lung, right side. Then the other one also right side pleural effusion is there. Both also right side effusion. The collapse is also there. So this is the pleural fluid after tapping is stored in a sterile vial sent to the laboratory for analysis. You see in the right side, you can see hydrothorax or pleural effusion. So in this picture, you can see tension pneumothorax, air. So this is the analysis of the pleural fluid, and there is inflammatory cells. Lymphocytes are same. Okay. Non-inflammatory cells are same. See, right side, there is the product, huge product, leading to lung collapse. The chest drain shape triangle is same, the right side. Okay. You are not harming or injuring the lung band. See, position, tapping, lung cancer, traumatic pneumothorax. Fluid is collected. Okay. The first drainage. Where pleural tap is done. See, air fluid level is there. Pneumothorax. The right side you can see pleural effusion. So you can see The right side, there is pleural effusion. It's a great combination. Cavity. So pleural effusion can be because of tubercular infection, or because of pneumonia, or because of malignancy, or maybe translate because of cirrhosis of the liver, or nephrotic syndrome, or autoimmune anemia. So other causes, malabsorption syndrome, etc. You can see in the right side, there is a vision, tissue, the fluid is in under microscope. So here, left side there is a microscope. For microscopic picture of the fluid, you can see inflammatory cells, chronic inflammatory cells, lymphocytes. Lymphocytes are chronic inflammatory cells. You can see the so you can see this patient microscopic picture. Fluid, you can see inflammatory cells. Again, microscopic picture of the fluid, you can see lymphocytes. So, microscopic study, you can see lymphocytes, other inflammatory cells. The blue color, green colored lymphocytes. Lymphocyte number. If you send there the blood rate for AFP and culture, AFP if it is positive, that is tubercular productive. Culture, some pneumonia, bacteria is there, can be pneumonia. We can also get the opinion about the sensitivity test. Suitable antibiotic can be related and given to the patient. So today we have discussed the thoracentesis or pleural fluid tapping. It may be used as diagnostic or therapeutic purposes. The quantity of the fluid, the composition of the fluid, like the chemical composition and the bacteria content, these are used to evaluate the cause of pleural effusion. Thank you for patience.